I know that I join the rest of the Utah medicine community in wishing the President, the First Lady, and all the members of his team who may be impacted by this infection a speedy recovery and sincerely none of the ill effects of this terrible virus. I'm worried about when I hear about, the First Lady, the President, one of the President's advisors, 3 people being infected and a group of folks who are working very closely together and who are frequently getting tested, is the potential for an outbreak within that facility. I sincerely hope that's not what happens, but clearly this is a group of people who are being surveilled at a very high level, but there was somehow the virus got in there, and we're looking at potentially more infections going forward. So for COVID-19, the disease caused by SARS-CoV-2, really when you're not in the hospital, it's about symptom management. I think from what I understand in the media, the President has cold-like symptoms and maybe some fatigue, which are very consistent, and there's no special treatment for that. Things like acetaminophen or Tylenol for symptoms, really paying attention is probably the most important thing. I'm sure the President's physicians are keeping a very close eye on, for instance, his oxygen levels, which we know can sometimes present as being very low, even with not very severe shortness of breath symptoms. But in terms of treatment, there's no additional special medications or other treatment that we have for folks when they're outside, when they're at their homes with COVID-19. And I'm sure that's what the situation is for the President and the First Lady. Should he or the First Lady or any member of his staff with COVID-19 be hospitalized, then we start looking at some of the COVID-19 specific treatments. So as it stands right now, we really have 2 main medication-oriented therapies, in addition to supportive care for anybody with an infection like this. The first one is remdesivir, which pretty much everyone who is inpatient is getting. This is a medication that can be delivered. It's an antiviral that affects the SARS-CoV, the virus that causes COVID-19. And then for people who require oxygen supplementation, so helping them with their oxygen levels, then we can also give a medication called dexamethasone, which is a type of steroid. And that's both those medications are given quite routinely. I'm sure that the White House team, working with public health specialists and the physicians that take care of those folks, are looking into people who are close to the President, not only to figure out where the President may have been infected, by which direction, but also who the President may have exposed. We know that the President's very active. It is meeting with a lot of people for a lot of good reasons, as well as the election reasons, and often doesn't wear a mask in those interactions. And we know that that's a very high risk for transmission. We have to remember that we go back, when we think about those exposures, we actually go back 2 days before the person develops symptoms. And so that means that, if the President develops symptoms on Thursday, we would go back to Tuesday and Wednesday to think about those potentially exposed individuals. We have to acknowledge that, COVID-19 is transmitted by respiratory particles. Most of those particles are close to a person where they're most dense, but we know that in some circumstances with some people, they go farther. And, I'm not aware of the exact distance that Vice President Biden was to President Trump. But I'm sure that that's being looked at very carefully in terms of potential risk to the Vice President. So again, it really reinforces and emphasizes that we have to use the tools that keep us safe. The masks, the eye protection, the hand hygiene, staying home when we're sick, and the social distancing. These are all critical. We know that they work based on the science. And I think, unfortunately, this is a demonstration of what can happen when we don't stick with what we know.